Dr. Shekhar. If you could tell us if testing at this point is crucial. We know it's a viral season, but should we panic at all?
So it's a viral season, and it wouldn't harm people getting tested if they have some symptoms like cough and cold or minor fever or something. It wouldn't really harm to rule out that it's not COVID. And if it's COVID positive, it wouldn't harm sending the sample for sequencing. So to be alert and to be careful is a good thing. At the same time, it's not good to panic. So to be alert is to get tested if you have symptoms.
Right. Sneha, you know, it's better to stay cautious than worry later. So get tested often. That's what some of the experts say, and so is the doctor. What would you say?
Yes. You know, Nabila, I just want to bring in one point and also want to talk to Dr. Mande about it. Dr. Mande, good evening. Sneha this side. You know, I want to ask you about this, the double benefit of testing. A, we'll be looking for more cases and we'll know the actual picture. It's important from that point of view. Also, for genome sequencing to be done effectively, we need positive samples. Unless there are positive cases, there's no way to go about genome sequencing, which becomes extremely crucial at this point of time because of the uncertainty around this new sublineage, which has been in India since the month of July. So we need to know much more about it, isn't it?
That genome sequencing also tells you if new strains are emerging. So BF7 is already here, as we have seen yesterday some reports. But assuming that some certain individuals who are immunocompromised, if they get infected and a new lineage emerges, it is good to actually know that because we can very quickly quarantine these individuals and try to contain the spread of those apart from BF7. So if someone is positive, quarantine is the best strategy that has been actually observed. And if you can follow that, we will be able to contain as much as possible.
All right. Dr. Sarin, if I could come to you on the masking rules. Of course, India has not rolled out any compulsion as yet, or there's no mandatory mask rule declaration yet. It could come soon enough, but would you say it's better to just take on the responsibility yourself, don't wait for a formal declaration by the government and mask up if you're in public places? How important is a mask at all?
I'll just come to it. I want to add one or two points to what my colleague Dr. Mande has said. First, home testing kits are available. So people are scared of going out and getting tested in hospitals or clinics or calls. So you can use a point of care home testing kits. And the home testing kit is available. And if it is positive, you know it is COVID. And at least you know that if it is not, you are comfortable. Number two, testing must be done in first 1 or 2 days because Omicron, the variant which is there, may be negative after day 3. So it spreads very fast and it's only there in the first 1 or 2 days, not like the Wuhan virus which was there for 4 or 5 days. So having added these riders, I think testing is a very good idea and we as a responsible citizen and maybe physicians should recommend it. Coming to the masks part, I would say one can wait for the government to decide, or one as a citizen of India can take the things in the whole hand. You know, it is our own responsibility that if someone has cold or is slightly unwell, puts on the mask, or if you are working in crowded places or hospitals where exposures are more, I would suggest a mask should be done. It is the best vaccine and best protection for yourself. But to say it is mandatory, I think would require more data. And also, since people are been waiting for long, I would say to put it as mandatory in all places, I would say put it in crowded places, and maybe we should be very, very vigilant on our own self. Self-discipline would be the best thing. So that's what we do at all our levels.